Hello everyone and welcome back to our channel. I'm very happy to have you here. If you are preparing for COC examination, this session is specially for you. Okay? On this channel, our goal is to help nursing students and COC candidates prepare smartly, understand questions clearly, and build confidence before the examination. So today we are going to practice COC exam questions together, but we are not just going to identify the correct answer for each question. I will explain why the correct answer is correct and why the other options are not the best answer. And we will also look carefully at the scenario important keywords clue in the questions. This will help you to develop your clinical reasoning and avoiding common mistakes during actual examination. So don't just memorize the answers, okay? Try to understand the reason behind each answer. That is the best way to practice or prepare for COC exam. And before we start, if you find this practice questions or sessions helpful, please subscribe to the channel, like the video, and share it with your friends so that more nursing students can benefit. I think take a pen and paper, okay? Get ready and let us start our CSE practice questions, okay? Okay, let's start with the first question, okay? Question number 1. A patient with left side heart failure is most likely to develop A. hepatomegaly, B. peripheral edema, C. pulmonary edema, D. ascites. So let's give me 1 minute for your attempt. Okay, the question asks, a patient with left side heart failure is most likely to develop what? Okay, so before looking at the choice, remember the basic difference between left side and right side heart failure. When the left side of the heart fails, blood cannot effectively or efficiently pumped from the left ventricle into the systemic circulation. Okay, so as a result, blood back up into the pulmonary circulation, resulting in increased accumulation of fluid within the lung, particularly alveoli, which impedes or interfere exchange of carbon dioxide and oxygen. Finally, it causes pulmonary congestion, which progresses to pulmonary edema. Okay, so therefore the correct answer is C, pulmonary edema. Now let's quickly eliminate the other choices. Why not the answer? Okay, hepatomegaly or enlargement of the liver is more likely associated with systemic venous congestion, which is a characteristic of the sign and the symptom of right heart failure, not left heart failure. Peripheral edema is also commonly associated with systemic or right side congestion or heart failure, and ascites also means it is accumulation of fluid in the abdomen or peritoneum. It is also associated with systemic venous congestion, or which is the characteristics or the sign and symptoms of right heart failure. Okay, so remember this simply. Okay, remember in your exam or keep in your mind. Left side heart failure, think about lungs. Okay, the sign and the symptom of left heart failure is more similar with respiratory problems. Okay, and right side heart failure, think systemic venous congestion. Keep in mind in your exam. Okay. So let's move on to the question number 2. Question number 2, which symptom is most characteristic of angina pectoris? A. Chest pain relieved by rest. B. Persistent chest pain lasting days. C. Fever and chills. D. Productive cough. Okay, the question asks us which symptom is most characteristic of angina pectoris. Okay, so the important clue here is angina. Angina occurs when the myocardium does not receive enough or sufficient oxygen, usually because of the oxygen demand of the heart exceeds the available oxygen supply. Okay, so typically the patient experiences chest pain or discomfort, especially with exertion, which means when the patient moves, and what happens when the patient at rest. Okay, so as oxygen demand decrease, so the pain is usually relieved by the rest. It may also be relieved by the nitroglycerin, which means potent vasodilation, which is very important to dilate coronary artery and redistribute or flow of increased blood flow to the heart. Okay, so persistent chest pain lasting days is not the typical description of stable angina, and fever and chills suggest an infection, okay, an infection process rather than angina. So the correct answer is chest pain relieved by rest. Okay, so for exam, remember angina is equal to myocardial ischemia plus chest discomfort commonly relieved by the rest. Keep in mind for your exam. Okay, question number 3. Which laboratory test is most specific for myocardial infarction? A. Hemoglobin. B. Troponin 1. C. White blood cell count. D. erythrocyte sedimentation rate. Okay, so the question asks us which laboratory test is most specific for myocardial infarction. Okay, so the keyword here is specific. Okay, specific, keep in mind. When myocardial cells are damaged, a certain cardiac protein are released into the bloodstream. One of the most important marker is troponin 1. Okay, so it is highly specific for myocardial injury and is therefore the best answer among those choices or options. So the correct answer is B. Now let us look at the distractors or the other options. Okay, hemoglobin, it tells about the red blood cells and oxygen carrying capacity, okay, but it is not a specific marker for myocardial infarction. The same is true. White blood cell count can increase with inflammation or infection, but it is not specific for myocardial infarction. It is not non-specific, it is not specific, and SR is also non-specific marker of inflammation. Okay, so it is not specific. Therefore, when you see a question asking for a specific laboratory marker of myocardial infarction, think of troponin in your exam. Okay, question number 5. Which arterial blood gas finding indicates respiratory acidosis? A. pH 7.3, partial pressure of carbon dioxide 55 mm mercury. B. pH 7.55, partial pressure of carbon dioxide 30 mm mercury. C. pH value 7.45, partial pressure of carbon dioxide 40 mm mercury. D. pH value 7.48 and bicarbonate 30 milliequivalent per liter. Okay, the question asks us which ultraviolet gas finding indicate respiratory acidosis. Okay, so the first thing I want you to check in ultraviolet gas question in pH value. Okay, first identify the pH value first, whether it is acid or base. Okay, so low pH means acidosis. Always low pH indicates acidosis. Then we look for partial pressure of carbon dioxide. Okay, if partial pressure of carbon dioxide is elevated, that means the patient is retaining carbon dioxide. So in respiratory acidosis, we expect low pH plus high partial pressure of carbon dioxide. Okay, look at option A. The pH value of 7.3, which is low, and the partial pressure of carbon dioxide 55, this is greater than 45, it is above the normal, which is elevated. Therefore the correct answer is A. Now compare, okay, that with other options. Option B has high pH and low partial pressure of carbon dioxide, okay, which points toward respiratory alkalosis. Option C shows essentially normal value. Option D has high pH and elevated bicarbonate, which is more consistent with metabolic acidosis. So remember that respiratory acidosis, okay, is equal to carbon dioxide retention and low pH value or high partial pressure of carbon dioxide. Okay, keep your mind in your exam. Okay, question number 6. Which electrolyte imbalance is commonly associated with chronic kidney disease? A. Hypokalemia, B. Hyperkalemia, C. Hypocalcemia only, D. Hypernatremia. Okay, this scenario asks, okay, which electrolyte imbalance is commonly associated with chronic kidney disease? Okay, think about the main functions of kidney. Okay, in order to answer this question, it is better to think about the main functions of kidney. What's the function of kidney? Okay, the kidney help remove waste products and maintain electrolyte balance. Okay, so they are particularly important for eliminating excessive potassium from the body. So when the kidney function is impaired, potassium excretion can decrease. As a result, potassium can accumulate in the blood, resulting in hyperkalemia. Okay, so this leads to hyperkalemia. Therefore the correct answer is option B, hyperkalemia. Okay, what with the others? Let's see one by one. Hypokalemia means low potassium. Okay, which is not electrolyte imbalance emphasized in this question. Hypercalcemia only is not, it is too restrictive and does not answer, because the question about commonly associated with imbalance being tested. Hypernatremia means high sodium and is not expected answer for this scenario. So remember in your exam, okay, chronic kidney disease resulting in impaired potassium excretion resulting hyperkalemia, or increase the amount of potassium in the blood. Okay. Question number 6. I think question number 7. It is a number repeated. Question number 6. Anyways, no problem. This number matters. So assume it is question number 7. Okay. Which nursing intervention is most important after abdominal surgery? A. Encourage deep breathing exercise. B. Restrict movement completely. C. Limit fluid intake. D. Avoid coughing. Okay, the question asks us which nursing intervention is most important after abdominal surgery. Okay, so after abdominal surgery, particularly abdominal surgery, patients may intake a shallow breath. Okay, take shallow breath because of pain and discomfort. Okay, so this can contribute to poor ventilation and complications such as atelectasis, which means collapse of the lung or lung collapse, and post-operative pneumonia, especially aspiration pneumonia. Okay, so the patient with abdominal surgery risk for atelectasis or collapse of the lung and aspiration pneumonia. So one important nursing intervention is to encourage the patient to perform deep breathing or exercise. So therefore the correct answer is A. Encourage deep breathing exercise. So let's eliminate the other options or choice. Okay, we should not restrict movement completely because appropriate mobilization is important for recovering and penetrations of the prevention of complication, and we should not automatically limit fluid intake, okay, unless there is a specific clinical indication. And also we should not tell the patients to avoid coughing, okay, increase appropriate coughing and deep breathing techniques can help, okay, clear secretion and improve lung expansion. So remember, after abdominal surgery that after abdominal surgery, think about preventing pulmonary complications. Deep breathing will have better lung expansion and reduce risk of atelectasis and aspiration pneumonia. Okay. Question number 7. Which blood component should be administered to a patient with severe anemia? A. Platelet. B. Fresh frozen plasma. C. Packed red blood cells. D. Albumin. Okay, this scenario asks which blood component should be administered to patient with severe anemia. Okay, so first, what is the major problem in anemia? It is better to answer what is the major problems in anemia. So the patient has reduced red blood cells or reduced hemoglobin, which means reduced oxygen carrying capacity. So if the patient has significant anemia and needs red cell replacement, the appropriate blood component is packed red blood cells. So therefore, the correct answer is C, packed red blood cells. Now let us compare the other options, okay, or distractors. Platelets are mainly used when the patient has a problem with platelet count or platelet relating bleeding, okay, and fresh frozen plasma is used primarily to replace a certain clotting factor. Albumin is not the answer for this scenario because it is a plasma protein and is not just used to replace the blood cells, red blood cells. So the answer is okay, packed red blood cells. So in your COC exam, keep in mind severe anemia, think packed red blood cells. Don't forget. The purpose is to increase the patient's oxygen carrying capacity. Okay. The last but not the least, question number 8. The priority nursing action for patient experiencing anaphylactic shock is A. Encourage oral fluid, B. Administer epinephrine as prescribed, C. Restrict oxygen therapy, D. Place patient flat without assessment. Okay, the priority action or the priority nursing action for patient who is experiencing anaphylactic shock is what? Okay, as you know, anaphylactic shock is a severe potential life-threatening allergic reaction. Okay, so the patient may develop an airway swelling, bronchospasm, or hypotension. So those are the main characteristics patient with anaphylactic shock. Therefore, we need to intervene or intervention that need to be address life-saving problems. And the correct answer is option B, administer epinephrine as prescribed because it is potent vasoconstrictor. As you know, anaphylactic shock, which is characterized by generalized vasodilation, so we need to give a medication which makes vasoconstrict. So the potent vasoconstrictor is epinephrine. So it is the correct answer. So epinephrine is the first line treatment for anaphylactic shock because it helps reverse airway swelling, bronchospasm as well as hypotension by making vasoconstrictor. So now let us eliminate the other distractor options. Okay. For example, encourage oral fluid is not the priority during potential life-threatening anaphylactic shock or reaction. Restrict oxygen therapy, okay, is inappropriate because the patient may have serious respiratory compromise. So instead of restrict, it is better to administer oxygen. And placing the patient flat without assessment does not address the immediate airway and circulatory problems and may not be appropriate in every clinical situation. Okay, so when you are anaphylaxis, think always epinephrine or potent vasoconstrictor and bronchospasm reliever as well as responsible for decreased airway swelling. So epinephrine is the best option for anaphylaxis. That should immediately stand out to you in this examination. Okay, so thank you very much. Bye bye.